Good afternoon. Hi, everybody. Yehudis Shamroth here with Wellness Wednesdays. I apologize for the delay. I had internet problems in the house and it just came back on right now. So here we are. It's supposed to be 2 o'clock and it's 2:37. I'm really sorry, but most of you watch the recording anyway. You know, I'm a nurse anesthetist from Ramat Beit Shemesh, Israel, and I delve into many health and wellness topics every single week. If you're new to us here, please check out my YouTube channel with all the previous recordings of all different kinds of various healthcare and wellness issues, from mental health to physical health to emotional health to food, diets, lifestyle changes, anything that has to do with health and wellness and has to do with also alternative medicine combined with Western medicine. So thank you for joining us today. I don't have a lot of introduction today because I've interviewed an amazing person who can speak for herself, and the interview will be a very fascinating. You won't need my introductions. I will tell you a little bit about her, though. I want to share the screen in a minute because I want to show that she is with us by video. Okay, she's with us by video. I'm going to turn it on in just a minute. The topic today is intuitive healing, and it is something that I myself never thought I had the potential to do, but I do realize that I am an intuitive healer too. I don't like to say that I'm a healer because I believe that God is the ultimate healer and that I'm just the conduit. But she has a lot of opinions and a lot of interesting things to say about that. So I do feel like I do help people get well with God's help, and I probably do it in an intuitive kind of way, just including all the education that I've received in the past, both medical and alternative, putting them together. And I say probably every week that if you know enough about Western medicine and you know enough about Eastern medicine, there are no contradictions. I never looked at myself as an energy healer or an intuitive healer, but the body is all energy, and we see EKGs, EEGs. We know that at the cellular level, it's the ATP and every single cellular respiration, everything that goes on in the cellular microscopic level is all electric. So we do know that the body is sing the body electric, as they said in the 1970s. So without further ado, I'm going to describe my guest. I don't have a lot of introduction today except to talk about her because her interview is very interesting. Devorah Harrow. She is the founder of Beit Roga, and she's the chief practitioner there. Devorah is an intuitive healer and a craniosacral therapist and a physical therapist. She does also flower essence remedies as well. She opened a clinic in her home in Beit Roga, Israel. It's called the Center for Healthier Living. Her mission is to empower more people to be aware of their state of health and the profound health effects of relaxation and exercise and what they have on their overall well-being. Devorah received her BA in biology with a minor in psychology and from Yeshiva University, and she received her degree in physical therapy from New York University. She graduated in 3 higher levels of craniosacral balance in Jerusalem, and she has been working for other health clinics. She combines her physical therapy knowledge with her intuitive knowledge. She says she's been an intuitive healer since she's a child, and so it's a very interesting topic, and I don't have to tell you anymore, except please watch the interview that we made the other day, and we will be very interested to hear Devorah talk about intuitive healing. There we go. Hi, Devorah. Thank you so much for joining us today. We are so excited to hear all about what you do and how you came to become an intuitive healer. And we're just going to discuss, and in any way you'd like to discuss, because I know just very little bit about this. I know the kind of healing that I come from as a strict medical professional for so many years, and then getting into alternative medicine in my older years and realizing there are no contradictions between the two. So that's why I like to do what's called an integrative approach, but I have never considered myself as an intuitive healer. And so I'm so curious as to how you came to that, knowing that you also came from a bit of a more traditional background. So without further ado, please introduce yourself and tell us who you are and what you do and what your background, whatever you feel like sharing with us. We'd love to hear.
Okay. So Devorah Harrow, I live in Israel, been here for 21 years. I got my bachelor's degree in biology and then minor in psychology from Stern and then Yeshiva University, and then went on to get a bachelor's in physical therapy from NYU. That was right before I made Aliyah. And I since I was a kid. My first memories almost are of me studying people, me watching people, watching behavior, figuring out patterns at a young age. I was like figuring out, okay, so oldest in families behave one way, the youngest behave another way, the middle children behave. And I loved studying behavior. I from a young age knew a lot about people without conversations per se. I was just recognizing that I was just gathering information about people as I was watching them. And very young, I don't know, sometime in high school, I guess, I figured out that I loved the whole medical field, just good with the whole medical field, um, helping people if they had wounds or if they had scrapes or whatever, and stayed very calm in those kind of situations. And I don't know, just I'm the type of person who just knows what I want and then goes after it. And I loved everything about learning about physical therapy. I love all that knowledge. You know, my neighbor's daughter went for physical therapy, and I was like, oh, if you want someone to learn with, just come to me. I'll be your study buddy. Because I don't know how many times I've learned anatomy and physiology. I just love it. It's such, I'm what is termed an alchemist. I don't know if you're familiar with the phrase, but
please give your definition of that, because it's not it's a term we hear a lot, but we really don't know exactly what it means.
all right, so alchemists are, everyone has their unique talents and gifts that they came into the world with. And an alchemist is someone who is able to see all the magic in life and loves seeing all the magic and just knows that it's everywhere and brings it to other people through their excitement of their experience and their ability to express it in words and explain the beauty and the magic and things to other people. And so I'm an alchemist. And so, you know, learning about the human body is just like a discovery of magic, one body system after the next, and then how they integrate. And then, so I started out, you know, physical therapist and loved doing the work, loved working with people. And I realized early on that there were two types of physical therapists. There are, and maybe other people who are in the physical therapy field would like to expand on this, but I saw two basic types. One type are the people who work with their hands and allow their hands to inform them what's right for the client. And they work very hands-on and they're with the client, you know, either working on them bodily or being with them while they're doing their exercises, etc. And the other type of physical therapists are the type of physical therapists who work according to statistics and based on regimens of, you know, what other people have said worked, what other physical therapists have tried, and, you know, more scientific based, and they work more with the machines and with the electronic healing modalities more than the hands-on approach. And I just started, like I said, I'm someone who just notices things about people, and I just noticed like the same clients come back every 6 months. Either certain clients, obviously not everyone, but there are certain clients who come back with either the same pain or a pain in another area of their body. And I started feeling like we're not treating all of it. We're missing something. And there's something deeper here that's not being addressed. And even though there is so much psychology involved in learning about physical therapy, my minor in psychology was because I needed so many psych classes in order to go to physical therapy school. They really do teach you about the importance, you know, of touch. And some people are really coming because they need that touch in their lives and you know, the emotional side behind things. But it's still conventional. And I was treating more holistically, and I just wasn't feeling satisfied with the type of treatment I was able to give people. In the 25 minutes I had with them, you know, for some people that was good and that was enough, and it really worked. And for some people I was just like, something's missing. And for years, I had heard about craniosacral therapy over and over again, met up with it in so many different ways, and was working alongside a craniobalance therapist. Craniobalance is craniosacral with other healing treatments sort of meshed in. It's like an evolution of craniosacral, and it really gets to the core of an issue. You're dealing with the truth of an issue and not just the physical symptomology of the issue. And there's so many ways that the physical body, the pain that the physical body is showing, is an expression of an internal, more energetic, whether it's emotional, spiritual issue. And so if you're just treating the physical, then people are going to come back if there's a real emotional issue that's behind that physical trauma, that physical symptom. If it's a deep emotional issue, then it's going to keep cropping back up. And Craniobalance just hit the core of the issues. It was just exposed.
Can I just ask you, you felt like you realized you were missing, maybe not you, but other conventional therapists were not focusing enough on the core or the root cause of the person's pain or discomfort, but you had some kind of insight to it, right? And so then how did you decide that you needed to learn something more like craniosacral, just because you heard it was good or you knew somebody? Or because I also think that, I try to incorporate a lot of these things into my practice too, because you can't just do acupuncture, you can't just do herbs. You have to do, to me anyway, and I never stop learning, because that makes my
exactly.
personality, like a little bit drive everybody crazy, because I'm always going back to school, taking another course online, whatever. But I feel like there's no limit to what could offer a person, and you have to try a little bit of everything. I do EFT, and I do a little bit of craniosacral. I wouldn't say I'm certified in, I'd love to be, but like, how did you make that transition over to like realizing that the conventional wasn't enough for you? Or for the patients?
I feel like, okay, so we discussed the term alchemist, and there's also manifestors, right? So people who are living intuitively, people who are checking in with themselves all the time about what the truth is. So as a truth seeker, I feel like when you align yourself with, okay, there's more, what is it? Then God will show you, here you go. And God put things in my path. And I'm telling you, I was working alongside this craniobalance therapist who kept telling me for years, you need to take this course. You need to. And I had a bunch of little kids, and I just wasn't mentally open. Like, I didn't have the open space to deal with it and to learn something new at that point. And then all of a sudden, I was ready. And I took 3 courses, basically one after the next, in craniobalance. And then I became accredited to also teach craniobalance. But I took, the basic course, which encompasses, let's say, 70% of issues. And then I took hitmachliot. I took courses that give you specialization in certain areas. And then from there, I got nudged out of work. I mean, my dream had always been to work in a private practice here in Israel, and I wasn't moving there fast enough, apparently. So God kind of made it really uncomfortable for me to be working where I was working, and I left. And I said, okay, I've been working part-time out of my house, and I just became my full-time focus. And from there, I just kept tripping along the path as I discovered more and more about myself. Because again, when you set your intention to always be moving forward and upward and always be true to yourself, then you're going to find the ways to do that. It's going to just come up for you. So,
would you say that that's part of being intuitive? Like, the more we're talking now, I think, of course I'm intuitive in the way that I take care of people, because every person that walks in the door, I think, I ask them what they think they need, but I'm really thinking I want to figure out on my own what I think they need because they don't always know how to express it. And or I use
Right.
what they say and I do a little more or less, whatever, but it isn't too, I do work intuitively. I did that when I gave anesthesia as well because it was more of an art than a science in some respects because even though you had all your drugs lined up and you had all your spinals, epidurals, and medicine, everybody was different and everybody came with a different reason for being there and different history, different medical stuff. And so you had to learn how to like work, more broadly. So, but when you say you're an intuitive healer, like when someone comes to you, like what would they come to you for, and what like and how do you help them?
Okay, so I've noticed actually a change in the trend of who comes to me.
Okay.
And over the past the more I've allowed myself to share, to open up to my intuitive side, the more it's developed, and the more the people who come to me are already either in that state of awareness of, okay, there's something real here that I want to get to, or are willing to, step into that. They're ready. They want the healing. They just don't know exactly how, but they're ready. And someone once said to me that I should be advertising as a healer who works with people post-trauma. And I said, I don't want to advertise myself like that because so many people don't realize they've been through a trauma. And so they'll say, oh, I don't need to go to her because I haven't been through a trauma. And so many people either wouldn't consider what they've been through a trauma or don't remember that they actually were in a trauma.
Mm-hmm.
So, but really, people come to me and basically what happens is while they're lying on the table, or sometimes even from the moment they come in, I can sense things about them, about what's happened. I can only ever know what they want to share, right? Subconsciously, because sometimes people aren't going to talk about things or don't even know that there is something to talk about. But this is a safe space and people feel that. And people, I believe in, divine contracts, that the people who you're meant to work with you're divinely matched, so if there are 10 craniobalance therapists in the area, why is someone going to come to me? Because there's something about me that tells them that they'll get their healing here.
Mm-hmm.
And that can happen with any of the other 10 therapists. It's just there's a chemistry between the therapist and the client. I don't like the word therapist. It sounds very clinical. I prefer the term healer. But so when people come and lie down on the table and I start working with them, information just starts coming to me about them. And, I've had many times it happen that I'll say something and someone will be like, well, how did you know that? Working with pregnant women, I can sense what again, if the baby wants to share, if the fetus wants to share, if the mom's open to the whole process, and she doesn't have to say, verbally that she's open to it. Either she is or she isn't, and either her body allows the communication to happen or doesn't, the fetus. And I can sense things about a fetus. There was a time that someone came to me to induce labor for a very banal reason. It was around her testing schedule or whatever. And it was, let's say, 38 weeks, I think. And I said, look, I can check in, but if the baby's telling me that it's not going anywhere, I'm going to be honest with you, and we'll stop. We'll stop. And I could tell that baby just was not ready. This was not the baby's time. And he was like, leave me alone. Let me continue, my incubation. I'm very happy here. And I said to the mom, listen, we can continue the session or not, but you're not being induced right now. Like, that's not happening. I can't induce someone. I can only help the body relax and prepare mom and baby for the situation if it's ready to come. Because sometimes moms are tense and stopping the birth from happening by hyper focusing on how it's going to happen and what's happening, getting themselves into, and birth comes when the body is just in a relaxed mode. So like you mentioned before, when we were talking before we started recording, you know, when we use the term healer, we're not actually healing the person. God is the healer, Hashem Rofei Cholim. We are a conduit of communication with, Rambam says that every person, God created man with an internal physician, meaning we are able to intrinsically heal ourselves. And with the modern times, and we don't live outdoors, and we're not living in the rhythm and cycles of nature, and we're not having lots of quiet time where we're going inward and checking in with ourselves, and so many people have a decreased body awareness because they sort of put that voice, that intuitive voice, on mute, and they've just gone with the experts or with the things that pull them out of their body. And there's a lot going on around us to pull us out of our bodies and to pull our focus outward as opposed to inward. So some people don't have that intuitive feedback going on of, hey, I need time to rest right now, or they'll hear it and shut it off, you know? And how many women during their menstrual cycle really just want to rest more because God built in a week, because he knew we're superpower. He knew that we're just going to keep going, keep doing for everyone and anyone, you know, and he gave us a week where he said, okay, this is a week where your body is resetting. Take a week to just stop exercising, relax, do what your body feels that it needs to do.
The recording process. But you had some insight to.
Like what, how, but they're ready. And someone once said to me that I should be advertising as a healer who works with people post-trauma. And I said, I don't want to advertise myself like that because so many people don't realize they've been through a trauma. And so they'll say, oh, I don't need to go to her because I haven't been through a trauma. And so many people either wouldn't consider what they've been through a trauma or don't remember that they actually were in a trauma. Mm-hmm. So, but really, people come to me, and basically what happens is while they're lying on the table, or sometimes even from the moment they come in, I can sense things about them, about what's happened. I can only ever know what they want to share, right? Subconsciously, because sometimes people aren't going to talk about things or don't even know that there is something to talk about. But this is a safe space, and people feel that. And people, you know, I believe in, you know, divine contracts, you know, that the people who you're meant to work with you're divinely matched, you know. So if there are 10 cranial balance therapists in the area, why is someone going to come to me? Because there's something about me that tells them that they'll get their healing here. Mm-hmm. And that can happen with any of the other 10 therapists. It's just there's a chemistry between the therapist and the client. I don't like the word therapist. It sounds very clinical. I prefer the term healer. But so when people come and lie down on the table and I start working with them, information just starts coming to me about them. And, you know, I've had many times it happen that I'll say something and someone will be like, well, how did you know that? Working with pregnant women, I can sense what the, you know, again, if the baby wants to share, if the fetus wants to share, if the mom's open to the whole process, and she doesn't have to say, you know, verbally that she's open to it. Either she is or she isn't, and either her body allows the communication to happen or doesn't, the fetus. And I can sense things about a fetus. You know, there was a time that someone came to me to induce labor for a very banal reason. You know, it was around her testing schedule or whatever. And it was, let's say, 38 weeks, I think. And I said, look, I can check in But if the baby's telling me that it's not going anywhere, I'm going to be honest with you, and we'll stop the treat. We'll stop. And I could tell that baby just was not ready. This was not the baby's time. And he was like, leave me alone. Let me continue, my incubation. I'm very happy here. And I said to the mom, listen, we can continue the session or not, but you're not being induced right now. Like, that's not happening. I can't induce someone. I can only help the body relax and prepare mom and baby for the situation if it's ready to come. Because sometimes moms are tense and stopping the birth from happening by hyper focusing on how it's going to happen and what's happening, getting themselves into, and birth comes when the body is just in relaxed mode. So like you mentioned before, when we were talking before we started recording, when we use the term healer, we're not actually healing the person. God is the healer, Hashem Rofei Cholim. We are a conduit of communication with, Rambam says that every person, God created man with an internal physician, meaning we are able to intrinsically heal ourselves. And with the modern times, and we don't live outdoors, and we're not living in the rhythm and cycles of nature, and we're not having lots of quiet time where we're going inward and checking in with ourselves. And so many people have a decreased body awareness because they've sort of put that voice, that intuitive voice, on mute. And they've just gone with the experts or with the things that pull them out of their body. And there's a lot going on around us to pull us out of our bodies and to pull our focus outward as opposed to inward. So some people don't have that intuitive feedback going on of, hey, I need time to rest right now, or they'll hear it and shut it off, And how many women during their menstrual cycle really just want to rest more because God built in a week, because he knew we're a superpower. He knew that we're just going to keep going, keep doing for everyone and anyone, and he gave us a week where he said, okay, this is a week where your body is resetting. Take a week to just stop exercising, relax, do what your body feels that it needs to do. And we just shut that feedback off.
Well, many of us ignore that,
Yeah, and so
And also on top of that too, I just realized you could probably speak more to this, that I remember being in shock learning years ago that there were generations of women before us that really knew their bodies so well, they could feel themselves ovulate and they could feel themselves when where they were exactly in their cycles. And I know some people still do that now, but to me, I remember it being a shock to me. It's like, what? They can actually like intuit something like this. They can actually know that it's going to be this many days away, or this is exactly happening in their body. And I thought we are really far removed from ourselves if that's the case,
Yeah, well, many people are coming back to that, where we're seeing more and more, just like more and more of these healing paths are coming out, and the awareness is rising, and more healers are popping up. There's a greater sense that this world is going through healing right now. The universe is going through healing, and that could be another whole
Very interesting what you're saying. I'd like to, we know that there's a lot going on, and we were going to have healing at that time, but that the fact that we're on our way to healing and the process of it is also a very interesting concept.
Right. The secrets are being restored. These are things that the Imahot knew. This is the way that healing happens generations and centuries and thousands of years ago. And we are getting back to synchronizing more with nature, to responding more to our bodies, to the needs of our bodies, and hearing our bodies more. But so that's what, when we call ourselves healers, when I say I'm an intuitive healer, that means I'm tapping into your body's healing potential, and I am listening and really hearing the internal physician. And this is why bodies wake up when they're by me. People will, they'll go through such amazing experiences, because just like what anyone wants in life is someone who's really listening to them. And I listen. I am here to simply listen to the body and to its needs. And it tells me things, and my hands move to where the body needs my hands to be. You know, I'll warn people. You know, someone will come to me with back pain and I'll be like, okay, I just want to let you know, I've learned to warn people. I might not touch your back. You will be lying here for 1 hour and we might not even get to your back because the body will be guiding me today where your healing needs to be. And because the body is one connected piece of connected tissue with the fascia that connects everything, and most holistic healing practices are based on this fascia and the intelligence of the fascia, the communication of the fascia, and the fact that it's connected from the top of your skull to the tips of your toes in one continuous sheath. And there's an intelligence there. And so we're tapping into that intelligence, that intuitive healer. And so the healing might need to happen in your foot and in your ear and in your right shoulder. And that will bring the healing to your back. But I don't necessarily need to touch your back, or at least maybe not until the second or third treatment session. Mm-hmm. And allowing the body to inform you is how people heal. And eventually, the point is for people to get to a place in their lives where they're getting that information themselves, where they're hearing their bodies. The most important thing we can do for our health is to listen to our bodies, because then people can be in so much pain, and I'll just ask the body a question, or I'll prompt the client to say, okay, what is it your body wants to hear, or you know what, and I'll prompt a conversation, and just by hearing the question, just by hearing that it's heard, the body automatically relaxes and goes into what's called a still point, which is a deep point of healing, where the body spontaneously moves into a healing space of deep healing and brings the body up to a higher level of health. And just by having that communication.
Can I ask some questions? Just want to ask you, does a person have to be present with you in the room to do this? And you can't do this virtually.
No. I do virtual healing as well.
Do you?
Yeah.
No, I think more of an energy healing then, doesn't it? I mean, or not. I mean, you tell me.
I'll tell you why I don't like using that term, and I don't like it when people hear that term, because then the woo-woo, starts to come up and people start thinking, I actually my latest podcast vlog was about this, what really is into holistic healing and different aspects of holistic healing, and that this whole energy healing, I feel like people automatically shrink back from that. I know I used to, and
I'm trying to be more open to it, because one part of my journey is to say, okay, you can't, strict medical doesn't always help, and now you learn alternative, which is amazing, and I can't believe I didn't know this all my life, but Hashem didn't let my eyes open to it until I was 50 years old, and now I'm almost 60, and I really know it's like I should have been doing this all along in my mind, but at least I'm doing it now. But now the next phase for me is to be more open to like this energy healing, or is it something I could ever participate in? I've interviewed a few different people on this, and it's still a little bit over my head. But I want to learn about it. I want to know about it. And your healing, it sounds to me like it's more comfortable with me, because you're saying that you are intuiting the person's body's giving you information, and then you're also listening very carefully. And so based on that, that's how you determine your therapy for them. So is it always you always touching them? Are you using your physical therapy skills too still, or are you mostly just listening and hovering over them? Like what are you actually doing?
My physical therapy background gives me a huge knowledge base of the anatomy and physiology of the body. So it's a great basis for the cranial balance. Not every holistic healer has that background. And I wouldn't say it's necessary, but I love it. I love, having that that intimate knowledge of the body. But I wouldn't say, you can call it practicing physical therapy, because it's a healing modality that is used to help restore body function. So that's the definition of physical therapy. It's healing the body back to its functioning level. I don't need to be touching the body, even if the person is present. I can keep my hands off of the body and and bring the person to the same level of healing. And let me try to explain this. Because again, the whole concept of energy healing, yes, we are energy beings. We are, and you can feel that. And the way I explain this to people so that they're not like, waving me off, is when you've walked into a room where, and this has happened to almost everyone, where the people in the room were just arguing. And you walk in and they heard you coming, so they stopped. But you can still feel the tension in the room that is going on between these two people and the fight that just happened between them. That's energy. And you might also be reading their body language, but there's an energy charge between the two people that is showing up as clashing. And you intuit that. And intuition is not something that people should be like, shying away from and scared of. It's God informing us of the truth in any situation.
Mhm.
Is this good for me? Now, what comes up as true and resonant for me might not come up as true and resonant for you, but it is my personal God line of information. Is this true for me? And if it's true for me, it's healthy for me, it's good for me, it's going to help progress me in my life. And that's an incredible tool to have. But so let's try to not shy away from that word energy, and let's recognize that we have, as human beings, we are both body and neshama. And neshama is an energy system. The neshama is not anything physical. You can't touch your soul, right? Although people use that term all the time. Wow, that really touched me, when they're talking about something that touched their soul, because we describe it and talk about it in the same terms that we talk about our physical body. So there's an enmeshing of the two, and that is holistic medicine. Holistic medicine is recognizing that there's a physical matrix in which the soul matrix, the energy matrix of the body, converge in order to be able to live out the soul's purpose. But we are soul first, and the physical is an external matrix in order to allow us to then move our hands, and talk and walk and do all the things that bring us to our soul's purpose. So we'll stop right there, but just so let's think about that. And this is exactly what I teach about in my Nature of Healing course that I'm going to be launching in a few weeks. There's the physical anatomy, and there's the energy anatomy. The energy anatomy is the soul in all of its different energy forms. There's the auras, which are 7 layers of energy that are outside of our body. And part of it is also inside, but mostly outside of our body. And that's what we term as our personal space, right? When we feel like someone's too close to us, we'll be like, hey, get out of my space. Now, why do you feel like you've been stepped on? Why do you feel like someone's suffocating you? Because they are literally stepping on your body. It's just not a body you would call your body, but it is. It's your energy body. And that energy body is a blueprint of what's going on in the physical body. And so I can access, because I'm a soul and I have my energy body, I can communicate energy body to energy body. So no matter where someone is, I can access their physical, I picture them as if they're lying in front of me. I'll even position them, move them around, or I'll walk around their body, if it's a baby or if it's an adult, and I will feel as if I am standing over their body. I'm able to feel the same things as if their body's right there.
So let me just ask you, because we don't have a lot of time left, we're going to have to do a second session on this, and I want you to talk on your course. But when you see, can you give us a couple of examples of people who have come to you and then felt so healed and felt so relieved, or whatever, whether it's a physical or an emotional? Like, can you think of one or two cases that you could share that would, make it more of a understandable?
Yeah. Okay. So, birth trauma. So it's a real thing, not just for babies, but for moms as well. And I've had a couple of women come to me after traumatic births or miscarriages or anything to do with the reproductive system and the trying to bring a baby into the world. that has then made it difficult for them or challenging for them to either get pregnant or want to get pregnant or consider having kids or get through pregnancies that they were in. And so I can tell you, for instance, there was a woman who came to me and who said that she had had a difficult birth and she had been through, I believe, one other birth after that, and now she was about to have another child, and she really just wanted to leave the trauma behind her. She wanted to be able to go into the birth without this sitting on her, without, and just the thought and the, just, it can be like a cloud, like an ear cloud that just, stays right there in the back of someone's consciousness. And a couple of times during the healing session, it came up that there was a specific area on her spine that something was getting stuck, something wasn't flowing. And, I haven't even checked if that's exactly the level where they put in that epidural. You would actually know this, but it didn't matter in the moment because that's
Around 5.
What, sorry?
L4, L5, between L4.
L5? So for this person, it was coming up in a higher vertebrae, but it was coming up that that's where the trauma was sitting. That's where the trauma was sitting. And when I was working on the area in different ways, and she just started crying, and it just released in such a strong way for her. And it just, our bodies remember. Our bodies have memories. We don't just remember it up here. And sometimes we don't even remember it in our brains. We've blocked that memory.
Muscle and tissue memory, yes, for sure.
But the body's right. It's called a somato-emotional release, because so much in the tissues, it's stored in the tissues. And when at the time of the trauma, the body will absorb that memory into usually an area that is where the main trauma happened or related to where the main trauma happened, and it'll hold it there. And during craniobalance healing and intuitive healing, we can access those areas and open them, right? If the person can open up to that healing. And again, the person always needs to be willing to do it and even on an unconscious level, but also on a conscious level, because sometimes people will really stop at a certain point. I'm not ready for this. And I'll always say to them, if it's coming up for you right now, you are ready. But if you don't feel like it today, that's okay. But just know that nothing will come up to heal if you're not 100% ready to deal with it.
So what happened to this woman? And how many sessions did she need for this?
I think it was one session. I can't remember now. It was a couple of years ago, but I think it was one session. And I remember her just being amazed and just feeling so much relief. And then there are stories where, people will come for 1 or 2 sessions and then I won't hear from them again, but I'll see that whatever it was that they shared with me that was, difficult for them, I'll see them now living out, that aspect of their life in a healthy way. So I'll be like, because not everyone comes back and says, by the way, and it's very gratifying. I can tell you about babies that I've worked with, and I've been able to feel their characters when they're, these tiny little, I treated 2 twins, again, using the word treating in that lighter way of, being an access, a conduit for their own internal healing. But I was able to really feel what their personalities were like based on the 4 elements, fire, earth, air, and water. And their zodiac sign. I could just really sense it. And I saw their grandmother who was here while I was treating them. I saw her like 9 months later or something, and she was like, oh my gosh, what you said was it's exactly who they are. Each one, you described them perfectly. And there's just, when you are open to hearing whatever magic you might be able to hear in the world, you'll hear incredible things. And that's how I came to flower essences. You can just hear the energy, the healing, the support, the love that God has put everywhere in this world, and pull it in for yourself. I came from a background where I didn't have a lot of internal support. I had a lot of structural support, a lot of physical support, a lot of support to get to where I wanted to be in life, etc. But that heart support, that emotional support, that understanding and validating of who I am, that was very much mostly from within, with a few people who, yes, were able to give that to me as I was growing up. But when I discovered that this world, nature, is full of support network that really speaks to me, that sees me for who I am, that supports me in who I am, that can support everyone. I mean, the whole world of flower essence is just incredible and empowering to a huge degree, a tremendous degree, because there is a plant that will heal and support you and encourage you to be your best you. And it's
And I
just
ask
incredible.
you, tell us how people can reach you, and how can they take your course? When is your course going to be available? Because we're going to be shut off soon, I'm afraid, and because I have limited time on this Zoom meeting. But we'll for sure have you back again, and I'd love to know how people can reach you. We can have your website. I will put that on the chat when I go live.
They can reach me via Facebook, Devorah Harrell, with one R. DEVORAH, and they can reach me on my website at beitroga.com, BEITROGA. Most of my flower essences, the most recent ones aren't on there, but I've got around 60 flower essences. My course, Nature of Healing, I will be advertising on Facebook. I will be doing it online and also in person here in Israel at Beit Roga. And yeah, if anyone wants to reach out to me via phone, they can, ask you for my number. And the Nature of Healing course is going to be divided up into chapters. And we're going to be starting with something just to get people's appetite wet. We're going to start by talking about the 4 elements and the 12 zodiac signs, and how knowing this information can help enrich our relationships as parents.
And I'm signing up because it sounds really amazing. And people for treatments have to be to you in person. Is that what you're saying? You have to be in person?
If people want to sign up for
treatment? People be treated by you, though. You have to be in your office physically, right?
No, I treat people all over the world.
Okay,
it doesn't mean
that's what I wanted to know.
Yeah.
There will be people that will want to reach out to you, I'm sure. And I want to just thank you so much for taking time talking to us. I could talk for hours. It's so fascinating. And I'm like agreeing with you today, and you're confirming what I'm believing, and like I'm very excited about you launching yourself out there even more than you are now. I think people could really use you to lead us in the way of getting to know ourselves better and get to be intuitive about what we do need and who to go to help us with our healing. And I really appreciate you taking your very valuable time today to talk.
Thank you. Thank you for having me. And if people want to know more, they can follow my blog. I have a video blog on YouTube. So just check out Devorah Harrell, or Empowerment of a Woman, it's called.
And you do this only for women? No male patients?
No, I treat men, and the blog is just as much for men. Just the name came up because of my own journey over the past 6 months that I've been through. I've had a huge transformation in my life. And so the term came up, Empowerment of a Woman, and I go intuitively. So that's in Hebrew, I call it being Kedra. But it's for men as much as it is for women. And I also have a podcast, Healing from the Holy Land, that's available on podcast forum.
I'll post all of that on the chat when we do the live round. Thank you so much, and you have a beautiful, wonderful week and day.
All right, thanks
for joining me.
All right, have a great day.
Okay, that was Devorah Harrell, intuitive healer. And I hope you learned something. I hope you did. I know I learned a lot from her. I know I'll be in touch with her again. And don't forget to be intuitive about your own self and your own healing. And listen to this again for some more details, and contact Devorah, because she can talk to you from all over the world. And look at her video vlog. All the details are on the sidebar here. And she has a course coming up, which I hope that you attend. And Let's all become more intuitive. And thank you for Deborah for enlightening on that very fascinating topic of what being intuitive is and what intuitive healing is as well. Thank you so much for joining us. I'll see you next Wednesday. Have a great week.